November is National Diabetes Month, an issue for millions of Americans, and the disease can be particularly damaging to a patient's feet. The elevated blood sugar causes damage to blood vessels and nerves in the feet. And here with some tips on some shoes that could help with that and also some warning signs is Dr. Leon Watkins with Gulf South Foot and Ankle. Good morning.
Good morning.
So I guess I never thought about it before, even though both of my parents had diabetes later in life. Is the foot can be a warning sign?
Yes, one of the main areas, diabetes affects different parts of the body worse than others, and feet is one of the bad parts that really gets. Sometimes the first sign that people have diabetes is tingling and burning in the feet. Usually starts in the toes and slowly works its way back into the foot and even up the leg a little bit.
So if somebody's watching, maybe their parents have some tingling, or maybe they themselves, sometimes even in a surprisingly young age, have some tingling in their feet, that's a warning sign.
That's a warning sign, and that tingling is the beginnings of nerve damage, basically. And if left untreated, the feet can become completely insensate and they can't feel their feet at all, in which case they're at great risk for diabetic ulcers and lesions.
All right, this is not just a prop in front of you, but is that actually a diabetic shoe?
Diabetic shoe, yeah. So most insurance companies, including Medicare, realize the risk that diabetes poses to the feet, and they will pay for one pair of shoes and 3 pairs of inserts per year for diabetics. The shoes have to be, you need a prescription from your podiatrist, and your primary care doctor has to okay them as well.
So they have something with the arches to
yes.
sort of mitigate some of the damage?
That's right. They have to meet certain Medicare criteria, one of which to have added depth in the shoe itself to accommodate an insert to protect the bottom of the foot from lesions. They also have to come in an extra wide to accommodate a wider foot. They cannot have any inside seams that can cause skin irritation, and they have to have some sort of a closure system, either Velcro or laces. No slip-ons or backless shoes are allowed.
You had given us some tips for people who do have diabetes, one of which was don't soak your feet, another was never go barefoot.
Yeah, never go barefoot even indoors. Again, because diabetics tend to lose sensation in their feet, they're very subject to developing blisters, stepping on a needle, a toothpick, or something like that, and not even realizing it, and can form really nasty ulcers.
So for somebody watching, look at this as maybe another tool in your set of knowledge that, oh, I've got tingling in my feet, what does that mean? But obviously the best way to find out is a visit to your doctor.
Yes. We recommend anyone who's been diagnosed with diabetes to come in at least every 6 months, establish a relationship with a podiatrist, go in, get your feet checked, because again, you can't rely on how your feet feel, because you could have a serious problem going on and you would have no idea.
Fascinating. All right, Dr. Leon Watkins, thanks for that.
Thank you.